Have you ever had a period so painful you had to cancel plans, curl up in bed, and just wait for it to be over? If you've ever sat there with a hot bottle on your stomach, painkillers on the table, wondering, why is this happening every single month? This video is for you. Today, we're talking about how to dramatically reduce, and in many cases, almost completely eliminate, menstrual cramps using 14 science-backed strategies. I can't promise that you'll never feel another cramp again. Bodies are complex and everyone is different. But I can show you what research and real-world experience both agree on. Why cramps happen in the first place, what's going on in your body when the pain hits, and 14 practical things you can start doing to calm your uterus, calm the inflammation, and get your life back each month. This is general education, not personal medical advice. I'm not here to replace your doctor. But I am here to give you clear, simple, actionable information so you can ask better questions, make better choices, and stop feeling like you're at war with your own body. So if you're ready to move from "I just suffer every month" to "I understand what's going on and I have a plan," stay with me all the way to the end, because some of the most powerful tips are toward the second half of this video. First, let's quickly clear up what menstrual cramps actually are in simple language. When your period starts, your uterus is doing a job. Its job is to shed its lining, the tissue it built up in case you got pregnant that month. To do that, the uterus has to contract, a bit like a muscle squeezing and releasing. Those contractions are driven by chemicals your body makes called prostaglandins. Think of prostaglandins as little text messages that say, "Okay, uterus, time to squeeze." Now, a normal level of prostaglandins equals mild cramps, sometimes just a dull ache. Too many prostaglandins equals strong, painful cramps, nausea, sometimes even diarrhea, headaches, or low back pain. That's what we call primary dysmenorrhea, cramps not caused by another disease, just by this prostaglandin overflow. Then there's secondary dysmenorrhea, where the pain is being driven by something else going on in the pelvis, like fibroids, endometriosis, adenomyosis, ovarian cysts, pelvic infections, or other structural issues. We'll talk about this in tip number 1, because it's really important not to ignore severe or worsening pain. But big picture, most menstrual cramps come down to too much inflammation, too many prostaglandins, and a uterus that's squeezing too hard for too long on blood vessels and nerves. So our job is to calm the inflammation, balance the hormones that control prostaglandins, relax the muscle of the uterus, and support your body with nutrients that help everything work smoothly. That's exactly what these 14 tips are designed to do. Before we jump into remedies, we have to start with this. Tip number 1, make sure your cramps are not a sign of something more serious. Please pay attention if your pain is getting worse over time, not better. You have very heavy bleeding, soaking through pads or tampons every 1 to 2 hours. Your cycles are very irregular. Or you bleed between periods, pain continues outside of your period, sex is painful, you feel faint, dizzy, or extremely fatigued with every period. These can be signs of conditions like fibroids, endometriosis, adenomyosis, or pelvic infections, things that need proper diagnosis and care. So the first tip is actually see a healthcare professional if your cramps are severe, worsening, or affecting your daily life every month. Once serious causes are ruled out or treated, that's when lifestyle, nutrition, and natural strategies really shine. Tip number 2, optimize your vitamin D. Vitamin D isn't just about bones. It acts more like a hormone signal in your body. It helps regulate inflammation, muscle function, how your immune system behaves, and even how your uterus responds during your cycle. Research shows that many people with painful periods have low vitamin D. When those levels are corrected, their pain often improves, and some need fewer pain medications. Why might vitamin D help cramps? It can calm down inflammatory pathways that drive prostaglandins. It can support normal muscle function, including the smooth muscle of the uterus. It may help balance the way other hormones interact with your cycle. So, what can you do? Get your vitamin D level checked if you can. Talk to your healthcare provider about what dose of vitamin D supplement is safe for you based on your level, your skin tone, your weight, where you live, and any conditions you might have. Add natural sources where possible. Fatty fish like salmon or sardines, egg yolks, and some fortified foods. Combine this with safe sun exposure if appropriate where you live. This is not about megadosing on your own. It's about making sure you're not walking around deficient in a nutrient your uterus actually cares about. Tip number 3, get enough magnesium, your natural muscle relaxer. If calcium is the contract signal for muscles, magnesium is the relax signal. Low magnesium can make muscles more likely to cramp, including your calves, your eyelids, and yes, your uterus. Magnesium can help relax, smooth muscle, calm the nervous system, improve sleep, and support hormone balance. How to use this in real life. Eat magnesium-rich foods regularly. Dark leafy greens, nuts, and seeds, especially pumpkin seeds, almonds, cashews. Beans and lentils, whole grains like oats or quinoa, if you tolerate them. Many people also use a magnesium supplement. A form like magnesium glycinate or citrate is often better tolerated. Always follow the label and talk to your doctor or pharmacist if you have kidney problems or take medications. Some people also like topical magnesium, like magnesium oil or Epsom salt baths. The evidence on how much gets absorbed through the skin is still evolving, but many people subjectively feel more relaxed after a warm bath with Epsom salts, and that alone can be helpful. Tip number 4, build an anti-inflammatory plate. Remember those prostaglandins we talked about? Your body makes them from fats and influenced by your overall inflammatory state. Eating in a way that calms inflammation can make a real difference in cramp severity over time. Focus on plenty of colorful vegetables, especially leafy greens, carrots, beets, bell peppers, broccoli, healthy fats, olive oil, avocado, nuts, seeds, fatty fish like salmon, sardines, mackerel, great source of omega-3s, quality protein fish, eggs, poultry, beans, lentils, tofu, etc. Try to cut down on ultra-processed foods, sugary drinks, fast food, and deep-fried snacks, excess refined flour, white bread, pastries, etc. This doesn't need to be perfect. Even small shifts, like replacing soda with water or sparkling water, or adding a big salad to your main meal, can lower your overall inflammatory load, which can translate into calmer periods over the next few months. Tip number 5, keep your blood sugar steady. High roller coaster blood sugar and high insulin are linked with inflammation and hormone imbalances that can make cramps worse. Practical steps: don't make sugar your main snack. Pair carbs with protein and fat. For example, apple plus peanut butter instead of just juice, rice plus beans plus veggies. Instead of plain white bread, avoid drinking calories all day. Sugary drinks spike blood sugar fast. If it fits your lifestyle and your doctor agrees, some people find benefit from time-restricted eating, like a 10 or 12-hour eating window, or simply not grazing all day, so insulin has time to come down. You don't have to go extreme to see benefits. The goal is fewer wild spikes, more steady energy, and over time, calmer cramps. Tip number 6, exercise before and during your period. When you're in pain, the last thing you want to hear is just exercise. But hear me out. Regular physical activity over the month has been shown to reduce the risk and severity of menstrual cramps for many people. Why? It improves blood flow, releases endorphins, your body's natural pain relievers, helps balance insulin, and weight reduces stress, which also affects pain. This does not mean you must run a marathon on day 1 of your period. What it can look like on non-period days: 20 to 30 minutes of brisk walking, light jogging, cycling, dancing, or strength training most days of the week. On period days, gentle walking, light stretching, or yoga short movement breaks instead of complete bed rest when possible if your pain is severe. Always listen to your body, but in general, staying gently active beats lying perfectly still for days. Tip number 7, don't underestimate heat. Heat is one of the simplest, safest, and most effective tools for many people with cramps. Adding warmth increases blood flow, helps muscles relax, soothes the nervous system. Options you can use: electric heating pad on low or medium over your lower abdomen or lower back, hot water bottle wrapped in a towel, warm bath or shower directed at the lower abdomen or back. Aim for 20 to 30 minutes at a time, making sure the heat is warm but not burning. You can repeat this several times a day as needed. For some people, heat works just as well as mild pain medication without the stomach side effects. Tip number 8, If you use pain medications, use them smartly. Conventional painkillers like ibuprofen or naproxen, NSAIDs, work by blocking prostaglandin production. That's exactly the pathway that's causing cramps. They can be helpful when taken at the very first sign of cramps, or even a few hours before your period starts if your cycle is very regular, used at the correct dose on the package, or as directed by your doctor, not overused every single day of the month, however. They can irritate the stomach, they may affect the kidneys in high doses, or with long-term use they're not suitable for everyone. For example, some people with ulcers, kidney disease, or certain heart conditions, so if you choose to, use them strategically at the lowest effective dose and always follow medical advice. The rest of the tips in this video are designed to help you rely less and less on painkillers over time. Tip number 9, try ginger. Ginger isn't just for nausea. Several studies have found that ginger can reduce menstrual pain, and in some trials, it performed similarly to common NSAIDs for cramps. How might ginger help? It has natural anti-inflammatory and antispasmodic effects. It may help reduce prostaglandin production. It's generally well tolerated. For most people, ways to use ginger: fresh ginger tea. Slice or grate fresh ginger, pour hot water over it, let it steep 5 to 10 minutes, add a little lemon or honey if you like ginger powder capsules. Many people use these around the start of their period. But always follow the product label and check with your provider if you're on blood thinners, pregnant, or have other conditions. Adding ginger to food, stir fries, soups, smoothies if you feel burning, heartburn, or any reaction, stop and reassess. Natural doesn't mean risk-free, so always pay attention to your body. Tip number 10, consider other gentle herbal supports with caution. Some herbs have shown promise in reducing period pain in small studies, including fenugreek, fennel, cinnamon, chamomile. These may help by relaxing smooth muscle, calming inflammation, supporting digestion and bloating, which often come with cramps. You might see these as herbal teas, capsules, traditional remedies. Important. Research is still limited. Quality and dose can vary widely between products. Herbs can interact with medications or be unsafe in pregnancy. So think of these as optional add-ons, not core strategies. If you want to try them, it's wise to discuss them with a professional who understands both herbs and your medical history. Tip number 11, don't ignore B vitamins and vitamin E. Some trials have suggested that vitamin B1, thiamine, may reduce period pain. For some people, vitamin B6 may support mood and premenstrual symptoms. Vitamin E may help reduce pain and breast tenderness in some menstrual disorders. Rather than chasing single megadoses, a safer approach is eat foods rich in these vitamins. B vitamins, whole grains, legumes, eggs, meat, seeds, nuts. Vitamin E nuts, especially almonds, seeds, vegetable oils, spinach, avocado if you and your doctor decide on A. Supplement. Choose a balanced formulation rather than huge doses of a single vitamin. Follow recommended amounts. Think of these vitamins as support staff, helping your nerves, muscles, and hormones work smoothly. Tip number 12, check in on iron and zinc, especially if your periods are heavy. If you lose a lot of blood each month, you can gradually become iron deficient. That can lead to fatigue, shortness of breath, hair shedding, restless legs, and sometimes it can worsen how you feel during your period. Overall, zinc is also important for immune function, hormone balance, wound healing, and inflammation control. Simple things you can do include iron-rich foods, red meat, if you eat it, chicken, turkey, beans, lentils, dark leafy greens. Pair plant sources of iron with vitamin C, like lemon, orange, or bell peppers, to help absorption. Include zinc-rich foods, meat, shellfish, pumpkin seeds, nuts, beans if you suspect low iron, you're very tired, pale, or your periods are extremely heavy. Ask your doctor for a blood test before taking iron pills. Too much iron can also be harmful. Tip number 13, calm your nervous system. Pain is not just in the uterus. Your nervous system decides how loud that pain signal feels. Chronic stress, poor sleep, and anxiety can turn the volume knob up on pain. Small but powerful habits. Aim for 7 to 9 hours of sleep when you can try a simple wind-down routine before bed. No heavy scrolling right before sleep. Dimmer lights, gentle stretching, breathing, or a warm shower builds stress relief into your week. Walks outside journaling, prayer, meditation, or quiet time talking to someone you trust you can't remove all stress from life, but you can teach your nervous system to spend more time in rest and digest mode instead of fight or flight, and that absolutely changes how you experience pain. Tip number 14, turn this into your personal anti-cramp plan. Everyone's body is different. The real power comes when you track what you do and how you feel. Here's a simple way. Get a notebook or an app and track cycle days cramps, when they start, how bad, 0 to 10, where the pain is what you tried that cycle, heat, ginger, exercise, vitamin D, magnesium, etc. Over 2 to 3 months, start layering in the tips. Month 1, focus on heat, movement, and anti-inflammatory eating. Month 2, add vitamin D and magnesium with your provider's guidance. Month 3, refine with ginger, B vitamins. Better sleep, notice patterns. Did cramps get shorter? Did your pain score go from an 8 to a 5? Did you need fewer pain pills? Give yourself credit for small wins. Going from I lose 2 days every month to I can function with some discomfort is a massive victory. From there, you can keep tweaking. Let's recap the big picture. Menstrual cramps are not just in your head. They're real, they're common, and they're driven by biology we can actually work with. You learned that prostaglandins, inflammation, and muscle contractions are at the heart of most cramps. Vitamin D, magnesium, and a less inflammatory lifestyle can calm that system down. Simple tools like heat, movement, ginger, and smart use of medications can give both quick relief and long-term improvements. Tracking what works for you is the key to long-term change. I'll say it again. I can't promise you will never feel another cramp, but I can tell you that many people see huge improvements when they combine these strategies and give their body a few months to respond. If you found this helpful, don't keep it to yourself. Share it with a friend, a sister, a daughter, anyone you know who loses days every month to period pain. And if you want a deeper dive into vitamin D, magnesium, and hormones, and how they affect way more than just your period, check out the video I've linked next on your screen. Take care of your body. It's working hard for you. I'll see you in the next one.